Assalamualaikum, my name Muhammad Nizam bin Abdul Aziz. I am a student from MLS 13 KKM. Today I will be presenting my case study on the topic the validation of serum electrolyte in hyperlipidemia sample. In this presentation, I will cover the objective, introduction, patient illness summary, laboratory investigation, discussion, conclusion, and some reference. The objective of this presentation is to demonstrate the troubleshooting technique in the validation the result of renal profile in lipemic sample, to discuss the validity result that can be released for the lipemic sample, and lastly to give awareness the importance in troubleshooting the result of renal profile in lipemic sample. Interfering in clinical laboratory can be substantial source of laboratory mistake with the potential of seriously impact the patient. The most prevalent endogenous interference that might affect the outcome of several laboratory techniques which come after hemolysis is lipemic. Hypertriglyceridemia, which causes increased stability, is a characteristic of the lipemic blood sample. The frequent pre-analytical cause of lipemic sample are insufficient time spent collecting blood after meal or pre-parenteral administration of artificial lipid emulsion. Laboratory professionals should be aware of issues such as false positive finding and lack of manufacturing uniformity. Even though assessing lipemic index on analytical platform is the best technique to determine the extent of lipemia can be eliminated and measured in clean sample, unlike hemolysis and etheric, which cannot be eliminated. However, because it depends on analyte that must be identified, the methodology for extracting lipid for the sample must be carefully designed. This is a patient illness summary of the case study. A 33-year-old man was admitted to the hospital because of a fever with several headaches, especially behind the eyes. He complained feel muscle and joint pain, especially in the knee, ankle, and the elbow. He also complained of experiencing an unpleasant taste in her mouth and loss of appetite, which is often accompanied by abdominal pain, vomiting, and diarrhea. After taking his breakfast in the morning, he collapsed and brought to the hospital by his father. Dengue repeat tests have been done and the patient was confirmed to have dengue fever. Renal profile tests show the parameters are below the normal range, especially serum electrolyte for sodium, potassium, and chloride reading. The result of the serum index have also showed the sample is grossly lipemic. After being examined by the laboratory technologies, it was found that there was turbidity in the patient plasma and there was a layer of the fat on the top of the specimen tube. Therefore, several steps have been taken to deal with this problem occur. This is the sample after centrifugation and the result that show all parameters are below the normal range. During the routine biochemistry, renal profile is required to be done to monitor electrolyte balance in the body for fever case. The renal result show all parameters are below the normal range, especially serum electrolyte, sodium, potassium, and chloride reading. The result of the serum index have also shown that the sample is grossly lipemic. The volume of displacement effect is the situation that affects the concentration of electrolyte. The normal plasma consists of approximately 92% of water and 8% of lipid. In the lipemic sample, the proportion of the lipid phase increase and can be up to 25%. Analytes that are not distributed in the liquid phase are distributed in aqueous part of the sample, which now account for only 75% of sample. Method that measure the concentration of electrolyte in the total plasma volume including the lipid plasma, like flame photometry or indirect phototherapy. Result is a falsely decreased concentration of electrolyte because of the high dilution prior to the analysis. Multiplying obtained result after the measurement to be full plasma volume result in the error in electrolyte concentration. Therefore, the sample of patient must be need to be troubleshooting to the result of the renal profile can be released in validity. Here are some troubleshooting that have been made. First of all, the patient plasma need to be separated into secondary tube before being centrifuged using a high-speed centrifuge at a speed of 4,500 rpm for 5 minutes. This step need to be performed correctly to allow the fat and plasma to be completely separate. After the centrifugation process is complete, it clearly can be seen that the color of the plasma turn clearly and the fat at the top are being removed from the tube. The sample then has been reanalyzed. After the sample was completely reanalyzed, it showed the true value of renal profile test reading for the patient sample. The result that have been validated and can be used by the clinician to treat the patient. As a conclusion, in order to ensure that the result of renal profile tests were released in a valid and reliable manner, a number of manual troubleshooting steps and associated parameters are main emphasis. This is some reference that have been made. That's all from me. Thank you.